Welcome to Country First. In this edition of Country First, Dr. Yvonne Larry of GCSCORED Caribbean Counseling takes a look at mental health.
Dr. Larry, tell me a little bit about yourself. I think Trinidad and Tobago knows or does not know enough about you, your cause, your focus, and your way forward.
Okay. Well, thank you so much for having me and coming to do this interview. I am originally from Trinidad. My parents live in Samoa, Pastor and Mrs. Hartwell Murray. And people might know my dad. He used to sell books on Shackon Street and Frederick Street from his van. Wow. So that's what, he used to help his children go abroad, those of us who went abroad. And so I've been going for about 30 years now.
That's a long time.
Yeah, it's a long time. But I still, come home on a regular basis. My parents are here, my siblings, some of my siblings are still here. I still have family and strong connections. And so my formative years were spent here in Trinidad and other Caribbean islands. And so I feel a sense of
There's still a connection?
yeah, an indebtedness to the region to give back because they who helped me become who I am today. So I left after one semester at USC and I went away to Andrews University in Michigan, cold. From there I graduated in 1992 with a master's degree in counseling, and then I moved to California. Is that the much detail you want? From California, I moved to Georgia, Atlanta, Georgia. Got my doctorate in Atlanta, Georgia. From there, I moved to Indiana, where I am an associate professor and department chair of counseling and human services.
That's a good thing, and I must say it is indeed an honor, and especially when you speak about that sense of indebtedness and wanting to give back. Mm-hmm. That is so important. Mm-hmm. 30 years outside of Trinidad and Tobago, and as you said, you're a regional woman. Mm-hmm. What is your focus, and how are you giving back to Trinidad and Tobago and by extension the region?
So let's see, my focus is I'm in the field of mental health, counseling, mental health. I'm in the business of transforming lives and creating safer communities. That's the mission of my nonprofit organization. And it is what I have spent those 30 years doing, honing those skills, honing my research abilities, learning and gathering information. While I was doing that outside of Trinidad and Tobago and the region, Trinidad and Tobago, as the rest of the world, was moving on and changing, and it sort of converged. The things that I was learning, the experiences I was having while in the U.S., and the needs and the gaps that were forming in this region, in Trinidad and the region. So it kind of brought it to a head. The needs on one hand and the skills and abilities that I was honing on the other hand. And so it came together in such a fashion that what I had to offer was what the Trinidad was needing. Necessary. Exactly. Okay. And I kind of feel like the U.S. has an abundance of resources, whereas the region doesn't have an abundance of resources.
It's somewhat crippled.
Right.
Mental health in the Caribbean,
mm-hmm.
and of course Trinidad and Tobago,
mm-hmm.
not much emphasis. I may be burned for this, but it's a reality.
It is.
We have mad people
mm-hmm.
walking around
mm-hmm.
town.
Mm-hmm.
He or she is mad.
Mm-hmm.
Bygones be bygones.
Mm-hmm.
from where you sit, and of course from your 30 years or your experience in the US, do we place enough emphasis? Do we need to do more? Do we understand the thin line between sanity and
Mental illness.
mental illness?
Yeah, we're in the Caribbean, in the region in Trinidad. Mental illness there's a stigma attached to it. And that stigma creates a barrier for people to get any types of support, emotional support, psychological support, even social support. Mental illness is not just, like you said, the mad person on the street, the vagrant, as we used to call it. I don't know what they call it now here in Trinidad. It's a continuum. Mental health is the ability to manage effectively your day-to-day task using social skills, emotional skills, and psychological skills. When those three building blocks are in place, we say, and is in balance, we say that the person has optimal mental health. When they are out of balance, there's a mental illness. And mental illness is, like I said, it's on a continuum. So we have people with basic adjustment difficulties or challenges. So maybe a child may have a difficult time transitioning from a family where the husband and wife, the parents were together, and the parents are now getting a divorce. That causes difficulty in transitioning, the child transitioning. It also causes difficulty with the couple. And so there are some issues of needing support, coping mechanisms to transition from a dual intact family to now a single family for all involved. That is a situation of mental health. Okay, so it's not the crazy person, as we say, or the madman and going into St. Anne's. That's one end of the spectrum. But we have the other end of the spectrum here. What happens, because there's such a stigma attached to mental health, the person here on this end who just needs some support and some techniques in terms of making that transition doesn't get it.
So a lot of us suffer in silence.
Suffer in silence and end up moving along the spectrum.
And at some point, it's very possible that we reach that madman stage.
Exactly, if there's no intervention.
Dr. Larry, the support system, the structure in the Caribbean, the infrastructure, what do we need to do? Physically, mentally, socially. Again, it brings us back to how much emphasis and focus is placed on mental health in the Caribbean. Is it something, again, that we just sort of sweep under the carpet and we just ignore it? I mean, we see the signs, but we don't address the issues. Do we have enough individuals like yourself in Trinidad and Tobago that can actually, put the word out there and get persons who may have these symptoms or may have some challenges to at least start somewhere by seeing someone and talking to someone?
Yeah, so there are not enough resources. There are not enough support systems in place. But even before the support systems, there's not enough education or advocacy. People do not understand the breadth and depth and the width of maintaining mental health, or the role that one's mental health plays in your day-to-day activities. Again, the stigma causes isolation, causes people not to get the help that they need, causes homelessness, a lot of the dysfunction that we see publicly can be attributed to that stigma being a barrier. The education part, we have to educate people on mental health. I mean, people have, and what I say to people is, some people have diabetes. I wear glasses. It would be foolish of me to need glasses and not go and get a prescription, see the doctor, and get a pair of glasses. It's very similar. That's physical health, right? The diabetes, the high blood pressure, that's physical health. There's mental health. We are whole beings. And part of me, or part of you, part of all of us, is the mental, the physical, spiritual, social, emotional. Those are the components that make us human, that make us different than animals. And what we have done, and this goes way back to our colonialism, where the focus has not been on the social or emotional self. If you look at the UN reports on literacy and even numeracy in the Caribbean, we usually have very high literacy rates. Everybody could read. 99% or 97% of the population is literate. There's no mention of the emotional development. So the academic development, we're good. We've met the mark, we've even surpassed it. But no attention has been placed on the emotional development of individuals.
And how
do we do that?
How do we measure that?
How do we measure that? I think one of the ways we can start doing that is talking to kids in schools. Because in order to change a culture, in order to change a mindset, we have to start with the children.
And is this what your organization is?
And so my organization does, we work with children, we work with adults, we work with youth. Because our premise is fully engaging all stakeholders in order for wholeness to be attained. We believe in a systems approach because a child lives in a home with adults. And so working with the child in isolation is not going to be effective. Working with the parents without working with the child is not going to be effective. Working with the family and not the school is also not going to be effective.
So it's a collective effort.
It is a collective. The issues that we're facing, the lack of support for emotional well-being, the lack of support for social well-being or psychological well-being is integrated, collaborative issue. We cannot expect to use an isolated event or an isolated concept or intervention and expect to make a difference or make any significant impact on a system.
And I'm thinking, Dr. Larry, you talk about the emotional aspect. And for men, I mean, that's considered weakness in the Caribbean. So how do you get that balance? Again, it comes back to getting someone to say, okay, I'm not feeling 100%. I need to talk to somebody. But then they have that they get that response, oh, come on, be a man. Man up.
And that's the stigma. And that's so we have those societal stigmas that say it's not a man, you're not being a man if you don't, handle your business in silence. And so what do we find? How does that manifest itself? Domestic violence, aggression, not just in the home, but on the roads. I mean, I hate to say it, but Trinidadians drive like bats out of hell. There you go. And so the issue is so complex. We can spend the entire day talking about it and not be able to resolve it. But one of the things that I want to bring home is using a systems approach to intervening, to preventing, to advocating, working in collaboration. Different stakeholders come with different skill sets. Sit around the table and let's remove our egos and who wants to be the top dog. It's not about you, it's not about me, it's about the next generation. How could we help them transition to be socially, emotionally competent individuals so that they can navigate the 21st century successfully? And our organization, GCSCORED, we have opened up our counseling center in Barataria. And our goal is to help children, youth, and adults and communities become socially, emotionally competent people, because that is what is going to help transform their lives and create safer communities.
And how can we take advantage of this? How can we reach you? Email address. Can I just pick up the phone and call you? Someone may be looking on now and saying, okay, maybe I may not speak to Dr. Larry, but I'll speak to someone else.
Yes. And so we are at 8th Street, 10th Avenue in Barataria. That's where we're located. Our number is 868-476-5454. Our email address is gcscored@gmail.com, which is gcscored@gmail.com. Our website is www.gcscored.org. You can reach us at any time, leave a message. And like you said, I may not be the one you may speak with, but we have 2 counselors, counseling psychologists on board. I also provide some distance counseling as well from Indiana, where I reside presently. And call our office and someone will be more than happy to help. That's one way that we try to make a difference. We also go into schools. We also go into churches, into communities. We recently, in the month of April, we launched the CAPA initiative, which is Child Abuse Prevention and Awareness Initiative. And we've been going into communities, hotspot communities, to provide education and awareness, skills on how to recognize child abuse, how to prevent child abuse, and also give the participants tools to intervene in child abuse situations. And so we're continuing that initiative for at least the rest of this year. And we want to provide counseling services to those individuals, to victims. Also, people who work with the victims. And there's a phrase that I say, people who influence and inspire. So if you find yourself in a position where you influence and inspire children or youth, you need to be trained on how to best and most effectively work with victims of child abuse, because they've already been traumatized, and we don't want, because of your passion, to reharm or re-traumatize. And so we provide training for individuals who want to be advocates for child abuse trauma. And child abuse, as we know, there are 4 parts to child abuse. There's the sexual abuse, physical abuse, emotional or psychological abuse, and neglect. Again, it's all on the spectrum of abuse. And so those are some ways. So we have our counseling center. We go into the community, schools, churches, community centers. We're supposed to be going to Laventille Girls Primary School shortly this week, and then we're going to be working with Silval before I leave, and then we're also going to go to Tobago. Because we understand the urgency. The United Nations sent out a report recently where it says 1 out of every 2 girls are abused, and 1 out of 7 boys are abused. And that is, they know for certain that the reports on the boys is underreported. In the US, every 10 seconds, a child is abused or raped. And so it's not that the region has a disease that the rest of the world doesn't have. The struggles are everywhere. And part of our GCSCORED's mission is to equip regular folk like you and me, lay people, with the tools. And we have a system in place. I've developed a framework, a counseling framework, an intervention framework that we are providing training not just here, but across the region and also in the US to get lay people, so that I would answer your question of, do we have enough people like me? No, we don't. But if I train hundreds of people with a simple technique that can help them to intervene on a child's behalf and not re-traumatize the child, then there's more protection, there's more intervention. And once they've implemented that intervention, then we can triage them to another level of care. But that is what we are working on. That's what we are doing to make a difference. And there's enough, sometimes I get frustrated because people tend to want to hug and guard some piece of the pie. And it's not necessary.
More damage than
exactly, because what happens is that the information does not reach the end user, which is the child. Mm-hmm. There is enough work. There are enough children and youth and adults in pain and in crisis for all of us to do something to make a difference. There's no need to be so territorial and so...
And if that is so, then it's totally defeating the purpose.
Absolutely. Absolutely.
Totally defeating the purpose.
And so, those are my messages that I want to... that I am coming back and forth, traveling to spread. That is my message, that's my mission. We also, like I said, GCSCORED works in over 7 Caribbean islands. We're conducting research. We're also conducting research in Ghana. We're also conducting research in Kerala State, India, as well as in the US. Because we also believe in order to make a significant and effective difference, we have to know what is happening. And to know that, you have to conduct research.
Yeah, that's most important.
Yeah.
Dr. Larry, thank you so much for chatting, sitting with us and giving us an idea as to what your organization actually, your path forward, what it entails, and your direction and your plan. And I do wish you the best. And I hope that individuals who are looking on, who may have issues or challenges or even questions, they will take the initiative, give your organization a call.
Yes.
And let's start this.
Yes. All right. I thank you so much for this opportunity. It's going to hopefully make a difference, not just here in Trinidad, but regionally as well.
Thank you so much.
Okay.
Representatives from the International Labour Organization, the ILO, recently paid a courtesy visit to Permanent Secretary of the Ministry in Social Development and Family Services, Mrs. Jacinta Bailey-Sobers. The purpose of the visit was to discuss issues of social protection in Trinidad and Tobago. The team led by Ms. Isabel Ortiz said that they have been engaging a number of countries to ensure social protection for vulnerable people. She also stressed that while many countries dependent on oil and gas revenue like Trinidad and Tobago have felt the impacts of the downturn, it was imperative that Trinidad and Tobago develop an overarching system to assist those who are affected. Mr. Ariel Pino, part of the ILO team, expressed that the organization is willing to provide assistance to the ministry by means of strategic tools that will help develop the ministry's ability to track expenditure and refine the ministry's targeted approach to social protection. PS Sobers said that they will be evaluating and reviewing programs and initiatives offered by the ministry in order to effectively target individuals that need the most help, and she welcomed the assistance and the collaboration with the ILO.